Hello, Year 13. This is Mr. Ferreira, and this will be the last video on the diction course, and it's going to be in Prochaska's stage model of behavioral change. So the key to this section is behavioral change, but this is just a stage model. So in other words, it's a model that looks at different stages that addict may need to go through in order to kind of change the addictive behavior. And I suppose there's many things that I don't know about this model because it is fairly new, but also there are some things that I do find very helpful. And the first one is that it does talk about many decisions. If you consider the TPB kind of effectively looked at one decision in order to change change a behavior, and looked at kind of what works on a person's intention. This one is talking about what are these decisions that an addict may make. It also talks about going through a series of discrete stages, and it also has some element of kind of understanding a person's motivation in order to change that particular behavior. And I suppose also it could be relevant to the fact that actually if addiction is genuinely a kind of behavior that's kind of entrenched in who you are as a person, there's a really good chance that it is not going to be easy, and that we even look at most models of addiction and we see that relapse is a key feature to all those models. So let's have a quick look at some of these things. As we can see, we have 6 different stages from pre-contemplation all the way through to termination. But I suppose what we do like to see is that it kind of divides it up into at least kind of 2 key parts. So the first part being about intention and what is obviously important at this particular stage, which is the pivot moment, is that this is all pre-action. So therefore, pre-contemplation, contemplation, and preparation. The person hasn't actually stopped the addictive behavior. But then we see that once that particular stage has happened, the behavior is talking about behavioral change. But we can also appreciate that termination is the key component here. So this idea that the person is abstains from the behavior and kind of never kind of goes back. Also, just reminding you kind of what I said in class about stages. So in other words, you start at stage 1, and only once the stage is complete, you go into stage 2. And once again, once you pretty much get to the point where you are wanting to go into preparation, then you move into stage 3. If for some reason there's a relapse, you kind of go back to the previous stage or the previous stages, and you can only get to termination if you systematically go through stage 1, 2, 3, 4, 5, and 6. So it says here, individuals move through these stages in order, but may relapse and revert to an earlier stage before repeating that cycle again. So I suppose what it is recognizing is that addicts pretty much, this is kind of normal to them. It's their type of behavior. So how do you approach this in terms of knowledge in the exam? I do feel that you need to at least have an understanding of what each of those stages are, and therefore a brief description of them is important. So I feel that if you can remember the names, they're pretty good because they pretty much explain what you should do. So pre-contemplation is literally before thinking. So for this particular stage, all we see is that the addict is before thinking that the drugs are a problem. So what they're focusing on is the particular behavior that kind of gives them pleasure. So therefore they say it's not problematic. They're unaware of this idea that it's a problem for them. It's only when they start realizing that maybe it is a problem, maybe they can't do something that they've previously been able to do, then it becomes a bit of an issue. So then they move into stage 2. And all it says is talk about contemplation. So in other words, you're thinking about this. So they're now aware of the problem and they are thinking what they should do about it. But they still kind of get the buzz, they still get the reward. So therefore this becomes a significant barrier to them, because it's kind of, well, why should I change? Because this is kind of something which I enjoy, or something that kind of is good for me. It's only when this becomes a bit of a problem potentially for them that they start thinking that they need to actually change. And so, of course, preparation means preparation. They start potentially little changes that they can do. I also question this potentially in the lesson, saying, well, some people who think they're going to give up perhaps do, have it one last kind of hurrah and go all out. But of course, if you're beginning to think that the addictive behavior is problematic, you're probably going to do something about kind of maybe changing some of them. But of course, all that this particular stage needs to do is prepare you for the action stage, and that is where you actually do stop the behavior. And so this is the first time really that you are actually doing something about it. And of course, it says you need to be fairly committed to this. Possibly it's at this particular stage that we do find that many addicts kind of revert back to the previous stages, because they just can't really deal with this. But what is quite nice here is that this is the first time that we see that there's some kind of reference to a time frame. And so therefore, what we need to recognize is that this looks at addictive behavior and saying that it is a process. What I'd hope at this stage is that any healthcare professionals recognizing that you do perhaps need some form of psychotherapy in order to kind of deal with these underlying issues. Also, it's not unheard of at this stage to potentially also be using some kind of drug therapy in order to help reduce the symptoms. Certainly, alcohol and many of the drugs will cause kind of very serious kind of side effects. Now, of course, if you're able to be in this action stage for 6 months, you then move into the maintenance stage. And I suppose the key to this was this word consolidation. So the things that were causing problems potentially in the pre-contemplation, contemplation stage of your life, you begin to kind of start seeing, okay, so this kind of works. So when you consolidate things, you put things into kind of perspective. So you might start kind of seeing the health benefits, or you might start seeing how potentially some of the behaviors that you were engaging in were harmful to others or harmful to yourself. And so what you do is you use these particular ideas in order to kind of keep you, and the word is maintain, so keep you there. And so we find that this time around we have this is after 6 months and more. It's also likely that a lot of addicts will remain in this particular phase. I mean, Prochaska himself kind of admits that very few people get to their termination stage. But I suppose if you are able to get to the point where it says you're no longer tempted, I quite like that idea. Certainly, if you've got addictive behavior that's problematic, you might want to do something about that. And so you've put all the kind of maintenance kind of tasks into perspective, and kind of helped you. It also potentially talks about we often see that former drug addicts and drug addicts tend to become like drug counselors, or kind of help kind of with academia and things like that in order to help addictive behavior. And I suppose they find a way kind of through this in order to kind of terminate their own behavior. And so it says keep building. So often it involves kind of a new life, a new kind of focus, and a new kind of goal. Now, that's all there is. It's fairly straightforward, it's fairly descriptive, and I hope you can see fairly problematic. Prochaska himself kind of talks about not actually giving you like how to make that shift. He just describes how you shift from one thing to the other. And you can read up on some activities that he potentially will talk about, or experiences that drug addicts might have in order to help them get to the next stage. But it doesn't say, okay, so in order to get from stage 1 to stage 2, this is what you need to do. So it's perhaps less practical than TPB. So where do we use it, or how do we use the stage model? Well, it's quite hard. So what it says here is that it can be useful if you're able to determine the stage the individual is in. So in other words, what we want to look at is, as a healthcare professional, I'm trying to help somebody with their addictive behavior. And if I am tackling them at the wrong stage, then I'm potentially not going to have a very effective treatment. So what Haslam and Draper basically said, that whatever whatever stage you were in the cycle of change, that could help you kind of determine whether you're going to be successful or whether you need to do something else. So, for example, if you're in the first stage, that's the pre-contemplation, you are less likely to change a particular individual's behavior, certainly with women who smoke during pregnancy. But they said that if they're able to determine that a woman was further along, so that they perhaps have, moved to maybe the action stage previously, or if they have actually discovered some of the risks or the problems that they might have, you can understand what stage then, and once again we can be effective and kind of help them. So it says that the interventions need to be tailored to the individual's particular stage, and that is useful, I find, certainly within a counselling perspective. Kind of knowing where the person is, or kind of what has worked and what could be good. I didn't say much about this, but of course, if I'm tailoring to individuals, it means you have to be sensitive to the individual's needs, but you could talk about economics and whether it's going to be cost effective. So it may not be appropriate that we use this type of model in kind of helping people. But there's also a few other problems. So it says here that there's evidence that suggests the model is not always understanding behavioral outcomes. Okay, so Whitelaw just looks at behavioral change and basically looks at all the studies that might have used a stage model, and says that most of the research kind of doesn't fully understand kind of how the change happens. It looks at what it says here, softer indications, so how many people have moved from stage 1 to stage 2, but it doesn't actually help us understand behavioral change. And you also kind of might say that we can understand that people might want to give up smoking or drugs or drinking, but the stage model won't necessarily kind of work for our understanding of kind of where they are. So it's kind of one of these weird things that it can be useful, but it's perhaps kind of a bit underdeveloped in terms of understanding behavioral change. So it says it may be an invalid assessment of change. So I need to maybe look at other factors that can help us understand kind of where a person may be. So then, looking at one of the last limitations, the last ideas, we just need to also recognize that there's a couple of things that it doesn't take into account, things like social norms, and this could be related to culture. Okay, this could be related to culture. So Dowd looks at research specifically in terms of Arab culture, and perhaps the likelihood that things like smoking, both cigarettes and sheesh, may be a cultural aspect and something which is expected of you at a wedding or funeral. And he says here, literally, if we look at these Arab smokers in comparison to the US and Europe smokers, that there's a significantly much more of them are still in the pre-contemplation stage. And this would make perfect sense because culturally they don't see it as being a negative thing. So of course they're not going to change. And so what we need to be sensitive to is this stage model kind of only really effective within a Western kind of understanding of kind of what an addict kind of goes through. And of course, if you are in some cultures, you might have a lack of wanting to give up the addictive behavior if the model doesn't appreciate that people might not see that kind of determination as being ideal. So therefore it has limited effectiveness in the therapeutic interventions. Now that is kind of all I'm doing. I hope that you've enjoyed the addiction course and that these videos have been helpful to you. I'm going to make one more loom where for this course where I'm going to just look at the past papers and just get some kind of understanding of kind of what questions have been asked in the past. Okay,